It's week 2 or 3 of my treatment. What should I be expecting at this point for side effects of my chemo or radiation? So, 84% of you who view this YouTube channel do not subscribe. Please consider subscribing so that we can continue to grow our channel and add guests for your education. Week 2 or 3, the mouth may begin to feel tender on the inside. The muscles typically are still working in terms of swallowing and feeling as if things are going down the right way. We are not having any worsening usually at this point in our overall swallowing side effects, but we might begin to feel some gentle discomfort, pain, or tenderness. I use the word gentle lightly. In week 2, that may be the case. In week 3, we are now like, oh, this is not gentle anymore. This is starting to irritate me. It is common at this point in your treatment that you are also starting to experience some possible side effects of the sensation of a dry mouth, and you may begin to have some difficulty with a reduced mouth opening of your overall, what we call oral cavity or mouth. So your speech therapist will be monitoring these changes and these side effects. Your doctor and your radiation oncologist will be meeting with you weekly to ensure that your body is accepting the changes as you go through treatment. So we always encourage 2 things at this point. Listen to everything your radiation oncologist is educating you on and suggesting. Follow closely your speech therapist to determine if any diet modifications can begin to be helpful. What's a diet modification? Well, possibly your speech therapist is going to suggest that you go from regular foods to softer chewable foods, wetter, moister foods. Each one of you will be different depending on where you started in your treatment. Maybe you started on wet foods and now it's time to move to smooth and creamy or pureed. Continue to follow us and keep doing your exercises during week 2 and week 3 of your treatment prescribed by your speech therapist.